Does rheumatoid arthritis run in your family? If you're worried about your risk or wondering if it's genetic, let's break it down in a simple, honest way so you can take control of your health. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge, low-risk treatments. One of the most common questions I get is rheumatoid arthritis genetic? It's a smart question. If you've watched a parent or sibling struggle with RA, you naturally want to know, am I next? In this video, I'll break down the science of RA and genetics in simple terms, what increases your risk, and most importantly, what you can do to reduce that risk and live well, even if RA runs in your family. Rheumatoid arthritis, or RA, is an autoimmune disease. That means your immune system, instead of protecting you, gets confused and starts attacking your own joints. Over time, that leads to inflammation, pain, swelling, and stiffness, especially in the hands, wrists, feet, and knees. RA isn't just about joints, it can also affect your lungs, eyes, heart, and even your energy levels. Early diagnosis and treatment are key. RA is manageable, in particular if you catch it before the inflammation causes any lasting damage. So let's get to the big question. Is rheumatoid arthritis genetic? The answer is yes, but not in the way most people think. RA is not directly inherited. You do not get it just because your mom or dad had it. But you can inherit certain genes that increase your risk. The main gene linked to RA is HLA-DRB1, sometimes called a shared epitope. If you have that gene, your immune system is more likely to misfire and cause autoimmune problems like RA. If you have a close relative with RA, like a parent or sibling, your risk is about 3 to 5 times higher than someone with no family history. But even then, your chances of not getting RA are still greater. In other words, genes may load the gun, but your environment still pulls the trigger. So if you inherit the RA gene, what actually activates the disease? Here are what we think are some of the most common triggers. Smoking, the #1 environmental trigger. If you have the RA gene and you smoke, your risk goes way up. Infections, certain viruses or bacteria may confuse the immune system and spark an autoimmune reaction. Stress and poor sleep. These wear down your immune regulation and can tip things toward chronic inflammation. Hormonal changes, especially around pregnancy or menopause. An unhealthy gut microbiome. Your gut is a big part of your immune system. A poor diet, chronic antibiotics, or gut imbalance can play a role. Think of it like this. Your genes are the wiring, but your daily habits are the electricity. You need both for the system to short circuit. If you have a family history of RA, prevention matters. While there's no guaranteed way to avoid RA, you can absolutely reduce your risk and delay the onset. Here's how. First and foremost, do not smoke. This is the single most powerful lifestyle choice you can make to prevent RA. Also focus on your gut health. Eat whole foods, vegetables, fiber, and fermented foods like kimchi, sauerkraut, or kefir. Stay physically active. Even walking helps your immune system stay balanced and your joints stay strong. Prioritize sleep. Your body resets and heals at night. Poor sleep leads to higher inflammation. Use supplements wisely. Omega-3s, turmeric, vitamin D, and probiotics can help to lower inflammation gently as well. If you know you're at risk, these steps are not optional. They are your daily tools to stay ahead of the disease. If you're already noticing early signs of RA, like joint stiffness that lasts more than 60 minutes in the morning, swelling in multiple joints, or fatigue that doesn't go away, it's time to get evaluated. Early diagnosis is crucial. The faster we catch RA, the more joint damage we can prevent. Your doctor should look at your symptoms and examination findings, labs like the rheumatoid factor, anti-CCP antibody, CRP, and sedimentation rate, imaging like musculoskeletal ultrasound or MRI to look for active inflammation. A full evaluation is necessary because RA is a clinical diagnosis. it's not just about one lab result, it's about the full picture. Once you're diagnosed, the most important thing is to start treatment early. Why is that? Because untreated RA can lead to permanent joint damage in as little as 3 to 6 months. For moderate to severe RA, I strongly recommend starting medication. These are disease-modifying anti-rheumatic drugs, also called DMARDs, like methotrexate or biologic medications. They work by calming the immune system and preventing damage. When used early and monitored properly, they are safe and highly effective. That's just one piece of the puzzle. You also need to build a strong foundation with nutrition, anti-inflammatory foods like vegetables, berries, lean proteins, and healthy fats, regular exercise, strength and mobility, keep your joints functional and reduce fatigue. Sleep. Deep restorative sleep is essential for immune regulation. Supplements, omega-3, vitamin D, curcumin, and magnesium may help to reduce symptoms and inflammation. And for people with mild RA or for those looking to support their medication plan, we also explore alternative and integrative options, including peptides like BPC-157 or thymosin alpha-1, which help to regulate immune response and support healing. Regenerative medicine treatments like platelet-rich plasma or bone marrow concentrate stem cells can help with chronic wear and tear joints in RA patients who have controlled inflammation. These alternatives are not replacements for medication in active disease, but they can be incredibly valuable additions to your care plan. What I always emphasize is personalization. Not everyone needs the same path. Some need aggressive medication early on. Others may start with a conservative plan and monitored closely. Either way, the key is to start early and treat smartly. Let's address a few myths while we're at it. Myth number 1, if my mom had RA, I will definitely get it. The truth is your risk is higher, but it's not guaranteed. Lifestyle still plays a huge role. Myth number 2, only women get RA. The truth is that RA is more common in women, but men can absolutely get it too, and sometimes more aggressively. And myth number 3, there's nothing you can do if RA runs in your family. The truth is you can lower your risk dramatically with lifestyle changes, early screening, and personalized care. So, is rheumatoid arthritis genetic? Yes, but your genes are only part of the story. They may increase your risk, but they do not determine your future. Your lifestyle, your choices, and your awareness are just as important, if not more. If RA runs in your family, now is the time to be proactive. If you're already showing symptoms, do not wait. Get evaluated, get treated early, and build a long-term plan that helps you live well, move well, and stay strong. If you found this helpful, please make sure to like, subscribe, and visit our website at chicagoarthritis.com for more insights on staying pain-free and healthy. If you're ready for a personalized plan to manage your joint pain or RA, contact us. Until next time, take care of your joints and live well.